Hi, my name is Kate Lynch, and today I'm going to be talking to you about thyroid disorders. Alright, so what is the thyroid? The thyroid is the gland. It's shaped like a butterfly, and it's right in front of your windpipe and above your clavicle, so like right here. It releases hormones that regulate the body's metabolism, and it influences basically all of the organ systems in the body. The pituitary gland also aids the thyroid, and it releases a hormone called thyroid-stimulating hormone, and that will tell the thyroid to produce more hormones if needed. The hormones that are released basically tell all the organs how fast or slow that they need to work. Alright, so types of thyroid disorders, there's a bunch. So there's hyperthyroidism and hypothyroidism, and thyroid nodules, thyroiditis, and thyroid cancer. So today I'm only going to be focusing on hyperthyroidism and hypothyroidism. But as I said before, the other disorders include thyroid nodules, and these are small, non-cancerous lumps that develop on the thyroid gland, and sometimes the nodules cause a larger production of the thyroid hormones that lead to hyperthyroidism. Sometimes they even grow so much that it makes it hard to breathe or swallow. So the next one is a condition called thyroiditis, which is the inflammation of the thyroid. The inflammation causes the body's immune system to basically attack the inflamed cells, just like it would for anything else that was inflamed. So this is an autoimmune disorder, so because it's attacking the thyroid, it inhibits how it's producing hormones, and if the hormones aren't produced, then you develop hypothyroidism. And then the last disorder is thyroid cancer. There are several types of thyroid cancer that I won't be going into today because there are way too many. However, no matter what kind of cancer that it is, the treatment includes radiation and or removal of all or part of the thyroid. So if you don't have part of your thyroid or don't have it at all, that will lead to hypothyroidism. Hence why I'm focusing on hyper and hypothyroidism today. Okay, so hyperthyroidism. Hyperthyroidism is the result of an overactive thyroid gland. Too much of the hormone thyroxine is being produced, and that results in an accelerated metabolism and an elevated heart rate. If left untreated, it can result in heart problems or bone and muscle problems, irregular menstrual cycles in women, and fertility problems. So, symptoms of hyperthyroid syndrome. So there's a bunch, and you can see them right here. So there's fast, irregular heart rate, weight loss, enlarged thyroid, pounding of the heart, anxiety and nervousness, mood swings, increased appetite, shaky hands, heat sensitivity, difficulty sleeping, and fatigue. So one thing to note is that older adults, usually like 60 years old or older, they may think that they have symptoms of depression, and they also have some different symptoms that include loss of appetite, and they mainly only have like subtle symptoms, like an increase of heart rate. So it's really hard to tell if they have a hyperthyroid syndrome. So if they go to the doctor, it's usually important that the doctor test for their thyroid too, just to make sure. Alright, so risk factors. You're more likely to develop hyperthyroidism if you're a woman. More women, they're 2 to 10 times more likely to develop hyperthyroidism than men. You're also more susceptible to hyperthyroidism if you eat a lot of foods that contain iodine, if you're 60 years old or older, have a family history, or are pregnant within the last 6 months. Hyperthyroidism is a risk factor on its own for a disease called Graves' disease, and that's like inflammation of the eyes. They get kind of crusty and they swell up, and they might feel like they're pulsing out of their head. It's very uncomfortable. So it's important to know if you have hyperthyroid syndrome, just in case, so you can stay elevated in bed so blood doesn't rush to your face and make your eyes bulge. Alright. So treatment of hyperthyroidism. First, to diagnose, the physician will need to do a physical exam. So usually they'll like poke around up here and see. Sometimes they'll feel that it's enlarged, or if it's lumpy, like if they have the nodules. It's also important that they perform blood tests to make sure that the symptoms are caused by the thyroid, so they'll get results back, and if they see that there are high thyroid hormone levels, then they'll know that they have hyperthyroid syndrome. So the goal of the treatment is to bring the hormone levels back to normal. To do that, people will need to take anti-thyroid medication, sometimes radioiodine therapy, thyroid surgery, and beta blockers. Beta blockers are basically, they're usually used to control blood pressure. They won't cure hyperthyroidism, but they actually will help with the symptoms. So things like the pounding heart or the excessive heart rate, they'll keep that subdued so they won't feel it as much. Alright, so hypothyroidism. So in contrast with hyperthyroid syndrome, hypothyroid syndrome is when the thyroid gland does not make enough hormones. In this case, the thyroid is underactive, and with an underactive thyroid, the body's metabolism is slowed down a lot. So symptoms include feeling cold, weight gain, hair loss, fatiguing easily, being forgetful, depression. So just like hyperthyroidism, symptoms are kind of non-specific, and they're similar to a lot of that of other diseases, so it will be really hard to see if it's hypothyroidism. So again, doctors will have to do some blood tests and see if people's hormone levels are low, and if they are, then they'll be able to prescribe them with the proper medication. Okay, so risk factors. So it's not uncommon for people that had thyroid cancer or previous treatment for extreme hyperthyroidism to develop hypothyroidism. So risk factors include family history, an autoimmune disease, surgical removal of part or all of the thyroid gland, radiation treatment, congenital hypothyroidism, which is when the babies are born with it, thyroiditis, medications, too much or too little iodine, and damage to the pituitary gland. Hypothyroidism cannot be cured, but it can be controlled. Main treatment is medication, so taking the amount of the hormone that your thyroid does not produce on its own will bring your thyroid levels back to normal. So down here in the bottom, we'll see if it records my mouse, you can see this picture of this woman, and this is her in 2010 when her hypothyroidism was at a peak, and then after 4 years, she started taking medication that brought her thyroid levels back up to normal, and you can see that her weight came back down to normal, and she actually has, you can kind of see there's less swelling in her throat, if you will, at the bottom. Okay, so this is a study that I found on hypothyroidism versus the risk factors. So the study was done on subjects that were treated for a type of cancer with external beam radiation therapy, and this type of therapy is known to have side effects, one of which is hypothyroidism. The study takes all the risk factors into account to see who is most likely to develop hypothyroidism after receiving an external beam radiation therapy. So the characteristics that they included were race, gender, family history, and tobacco use. So you can see on the graph, if it records my mouse, that gender, females had a higher risk of getting hypothyroidism than men after getting the radiation therapy, which is common because females are more susceptible to getting a thyroid disorder. And also, family history, they had a higher risk of getting hypothyroidism than not having a family history. Race, I didn't really go too much into it, but African Americans did have a higher risk of getting hypothyroidism. And then tobacco use. It's actually inconclusive, so there's a lot of investigation going into it, but in the long run, smoking is not good, and you'll lead to risk factors for lung cancer or cardiovascular disease, so by any means, smoking won't help. Okay, so for this case study, we had an older woman, she was 61 years old, and she recently went to the doctor because she noticed that she had been feeling tired often. She had been gaining weight fairly quickly. Also, her appointment was July 15th, and she arrived wearing long pants with a t-shirt and a jacket. She walked into the office at 4 p.m., and her appointment was at 3. 3 o'clock, and she apologized for being late because she forgot what day her appointment was. So during the appointment, she filled out her family history, and we saw that her mother and sister had hypothyroidism. She came in because she was concerned about her weight gain. She was active when she was younger, but she grew older and started to fatigue easily, so she stopped exercising. So we can see that from the date that she came in, it was July 15th, and we know that that's summer, and it's usually typically pretty warm. But she came in wearing long pants and a jacket, so we can tell that she's getting cold easily, which is a classic sign of hypothyroidism. Also, she was a little bit forgetful because she came in late. So that's also another sign in older adults of hypothyroidism. And just the fact that she's over 60 years old also makes her at higher risk of developing a thyroid disorder. Her family history also indicates that she has hypothyroidism running in her family, and she also has gained a lot of weight. So all the signs pretty much indicate that she has hypothyroidism, and that is what the doctor diagnosed her with. Okay, so for the exercise prescription, so this woman came to me after being referred by her doctor to exercise in order to subdue her symptoms of fatigue and to lose her weight that she gained. So what I did was I prescribed her to exercise 5 to 7 days a week if she could. The more frequent, the better the results will be. So for the intensity, I have her doing a light to moderate intensity, and she can work up to a high intensity with time. She just needs to get used to working out again. And then time, 30 to 60 minutes of some sort of activity, but I would like her to do cardio, resistance, and flexibility. And for type, again, cardio, resistance, and flexibility. And I had her doing 10 to 20 minutes of each to meet the 30 to 60 minutes. So for the cardio recommendations, I prescribed her biking, walking, or swimming, which is low impact because of her age, and she seems to like it, and it's a good way to get her heart rate up because having her heart rate up will increase her ability to lose weight, and just having your heart rate up will improve overall fitness. And then resistance recommendations, I said body weight lunges or squats and medicine ball exercises. Again, I don't want her to do any heavy lifting because of her age. She can work up to it. If it turns out like she has no arthritis and she's really good at exercising and she really likes it, we can work up to it. But we have to assess her first and make sure that she's progressing well. And then flexibility, I recommended yoga. Yoga is just a good way to relax and a good way to end a workout. And overall, if you combine cardio with resistance and then flexibility, that's a really good way to start losing weight. So I did all of these because that will increase her metabolism, and because of the hypothyroidism, her metabolism is pretty low. So with exercise, with increased heart rate, and with increased exertion, metabolism will grow, and therefore it'll bring her metabolism levels up. And with her new medication, with her filling in those hormones that her body isn't producing, we should see results. Okay, so for some more information on thyroid disorders, you could go to these 3 websites. The first one is my favorite, the American Thyroid Association. The second one is the Cleveland Clinic at that link right there. And then the last one's for women with thyroid disorders. So it's specific to women because women tend to be more susceptible for the disorders. So it's a good website to go to if they have any questions or if they have anything that they want to look up. And here are all my references. The last one is from the case study, and all the other ones are just from any information I found. Thank you.